it working? Okay, guess who's back? This time, not failing this exam, okay? I don't know about the other one yet, because that was like 2 days ago. But this one is for biomedical ethics, PHLB09. Once again, like, this isn't really, the problem is, like, all of this is, like, kind of free knowledge. But I'm gonna be going, it's an oral exam, so I'm gonna be going over the people that are important in the 5 topics. So there's 5 topics. There's like assistance in dying, there's abortion, there's genetic screening, public health. Those are the, did I say 5? Oh, and advanced directives. I completely forgot about that. I'm not gonna lie. Okay. If I look down, I'm looking at my notes. But I'm gonna try not to do that. So if I look literally anywhere else, I'm probably not gonna look at my notes. Actually, if anything, can you even see? What if I put this here? Can you see it? Yeah. Okay. This means it's, you see the blue? That means it's closed. Okay. Okay, anyways. Okay. So we're gonna start off with um medical assistance in dying, or assistance in dying, okay? So there's 2 people, okay? Let me think of who. Because this is the first time I'm actually like going, I have the exam in like an hour. Anyways. Sorry, 2 hours. Um okay, there's 2 people, okay? There's Rachel Dresser, I think. And then there's Dawn Kewon or something like that. Yeah. And so Dresser. I keep mixing him up with Dworkin. That's why I'm like, whatever. Anyways, Dresser, his whole thing is that active euthanasia or passive euthanasia or whatever, it honestly, like, when it comes to like medical, in the medical sense, like, it depends. Because his whole thing is that the action isn't what actually matters, it's the motive and intention behind it. And then also the outcome, but for this case we're going to talk about the motive. And so, what's it called? He uses I think it's him that uses the example. Yeah, he uses the example of the Smith and Jones case. The Smith and Jones case is basically, there's these 2 cousins, okay? There's Smith and a cousin, okay? The cousin's gonna get all the inheritance, a lot of stuff, whatever, whatever, it doesn't matter. Smith wants the inheritance, okay? So while the cousin is showering, Smith goes up, or whatever, goes up to him showering or whatever, and he's like distracted or whatever, and he drowns him, and he kills him so he can get the inheritance, okay? And so that would be an example of active, like, actively killing, you know what I mean? Active euthanasia. And then the other hand would be, so Jones. Jones has the exact same situation, cousin, inheritance, and everything, except for he goes up to kill the guy or whatever, to kill the cousin for the inheritance. And he goes up there and he opens the door and he sees the cousin slip and fall and hit his head and like drowns by himself. And he's like waiting there to see if he actually fully drowns, because if he doesn't, like, he'll like push his head in or whatever. But he doesn't need to do that. The cousin just drowns, or like right in front of him. And that would be passive euthanasia. The fact that he didn't kill him or he didn't physically touch him or whatever isn't what matters, it's the intention, right? And so he has his whole thing is that it's not the intention that matters, right? It's like, it truly depends. And when it comes down to like, it depends or whatever, he, like, in my notes, like, I made a point to say that, like, killing, which is active euthanasia, is faster, therefore it's like better, in the sense that if the intention in like a medical sense is that you want to you like, someone wants to like stop suffering, like they have like terminal cancer or whatever, their like lungs are failing, they have a bunch of issues going on and they're just in constant pain, um the quicker and the more painless thing to do would be to kill them, which is active euthanasia, not like, you know what I mean? Like, it's this medical assistance in dying, okay? And then the next guy, his what's his name? Don Kewon? I don't know, whatever. His whole thing is that he really doesn't, he's against the idea of like, not against the idea completely, but like doesn't like the autonomy of killing. Like, he's like, killing is killing, whether it's yourself or not. And so his whole thing is that we already, like, okay, his 2 points. One of them is we should prioritizing autonomy as a value is a mistake. Okay, that's his first thing. Um, his well, that's not his first. Technically, it's his second, but that's the one I remember the best. And the first one, it basically has to do with like we shouldn't oh, there we go. We shouldn't respect all autonomous decisions. And so in the lecture or whatever, it kind of like makes a point to say that like we already don't. Like if we truly did respect all autonomous decisions or whatever, you would be able to go out and just buy literally whatever medication you want, or you could just like I don't know, you didn't need a license for a gun, like that kind of thing. You know what I mean? And for his second point, it has to do with what was his second point? Oh, it has to do with like historically speaking and even now, like there's so many values that like a human in society has. And one of them, for example, is killing is wrong. And that's like really held true throughout society. You know what I mean? And so like obviously there's an argument where it's like, okay, but maybe there's exceptions to it, like um we've grown as like a society or whatever, but like that's the idea. I'm gonna open this and see if I miss it. Because what I wrote was James Rachel. Did I say Rachel or did I say Dresser? Oh, I said Rachel Dresser. Oopsies. Oh my God, it's just wait. Whoopsies. Whatever. His name is James. Oh my God, I got both their. Oh my God, I got names mixed up. It's not Don Kewon. It's Don Marquis from the next one, the abortion one, and it's John Kewon. So there's James Rachel. Whatever, I got the Rachel's part. And then John Kewon. James Rachel, motive more than simple action, outcome and motive matter more. Smith and Jones case, action isn't doing the work. Euthanasia is sometimes okay, killing is quicker. For John Kewon, against autonomy, should not respect all autonomous decisions. We already don't. Giving priority to autonomy as a value is a mistake. Okay. So the next one, abortion. Yes, abortion. So there's two people again. There's Judith Judith Jarvis Thomson, and then there's Don Marquis or Marquis. I don't know. I think it's Marquis. I don't know. That's how my professor says it, so it doesn't matter. But what's it called? Basically, in terms of abortion, okay, Judith Jarvis Thompson, okay, her basically perspective is abortion is okay in some circumstances. Like she first starts off by saying like, okay, let's get it out of the way. Let's get rid of the personhood argument or whatever and just say that a fetus counts as a human, like has a life, has the right to life, okay? And so I'll get onto the why it's like kind of like circumstantial, but her main things is that she has like three analogies basically. She has the violinist case analogy or whatever. She has the tiny house one and she has a burglar one. And so the violinist one is basically like I don't know, you're sleeping one day and you get taken against your will and you wake up, okay? You wake up and you're attached to a violinist and basically like if you want to be detached from this violinist, like you have to be attached to him for 9 months and he'll wake up okay. But if you want to like detach yourself or whatever, he's gonna die. And so and the people are like, oh, like we didn't know whatever, but it's too late now, so now that if you get detached, whatever. And so basically this is an analogy for rape. Okay. And so she's basically saying you're like it happened against your will. You weren't obligated to um you weren't obligated to carry through with that. Like it's against your will, like despite even if it means that he will die. The violinist, I mean. And so then there's the tiny house one, which is basically like you and a child live in a tiny house and the child just like rapidly keeps growing, like huge, bro. If you don't do anything about it, the child will expand so large that he will crush you and you'll die and then he'll break open the house and he'll just walk off scot-free. And what's it called? Um And it's like if you and so this is like an analogy for what's it called? This is an analogy. Oh my god, what am I talking about? This is an analogy for what's it called? Like you have the right to defend yourself. Like if you have a baby, right? If you're pregnant, I mean, and there's a chance that no, like you're basically guaranteed to die or whatever if you continue having this baby, but the baby will live or whatever. You have the right to defend yourself. Like it's okay. And these analogies are basically like if you agree or if you understand that and you're saying like oh that's wrong or oh that's like okay or whatever, you're basically either against or not against abortion is basically what she's saying. And so then there's also like the burglar analogy, and so that's basically if just because you leave your window open doesn't mean a burglar should come in and steal, like can come in and steal like all your shit, you know what I mean? Like that doesn't mean that's right. And what that basically, what am I saying? Oh yeah. And that's basically like a metaphor for like when you have sex, when you have consensual sex, right? Um, Obviously you're aware that there's a chance you can get pregnant. If you have a uterus, obviously, you know what I mean, right? There's a chance that you can get pregnant with or without a condom, doesn't matter. You just know the fact that you're having sex, there's a chance you can get pregnant. But that doesn't mean you have to go through with it. You have to go through with being pregnant. You know what I mean? Like it's like just because the window's open doesn't mean you can steal everything. That kind of thing. But that goes to say like even though there's these situations or whatever, she has a thing called moral indecency. And basically what that is like in my head it's kind of like a time and place kind of thing. Like not place, but it's like she like the example is for the violinist case, right? If it like if it takes only an hour, she's basically like you should go through it because it's not. I think of it as like a in philosophy at least or ethics or whatever. There's a thing where basically if something is not of substantial harm to you, then you should do it. You know what I mean? Like in care ethics, if you're able to help someone and it won't like burden you so much or whatever, like you should do it. Like that kind of thing. And then moving on to Don Marquis. He has the same starting where he's like, okay, let's just get it off the way or whatever. He's like the anti-abortion kind of thing. Here's the thing where he's like right off the bat, like he doesn't talk about religion or anything, but he's like, okay, like let's just assume a fetus or like whatever has a right to life. Or is like alive, whatever, right? And so his whole thing uh, oh my god, why am I blanking? Oh, his whole thing has to do with the idea of a future. And so, or a value of future, or something like that. Future of value. There you go. And so his whole thing is that he starts off with like, why is killing wrong? And he says killing is wrong because it strips someone um of their future in which there could be like positive things in it. You know what I mean? Like if I was to die right now, I could have won the lottery like tomorrow. You know what I mean? That's it's stripping me of a positive aspect in my future. And so he basically says like killing us like the average person or whatever is wrong because it strips us of a value, a future of value or something like that. And then he goes on to say like fetuses are like a future of value to life or something like that. And then he goes to say like fetuses are alive or something like that, or fetuses have a life or whatever, or have a future. They have the opportunity of a future or whatever. Therefore, killing a fetus is wrong because you're stripping them of the opportunity of a future value. And it's not like he's not saying that they 100% do have a future. He's saying that it's like the opportunity. I don't really know how to explain it. I was a little bit iffy, so I hope they don't ask me about that, but whatever. I love my TA though. My professor is Eric Matheson, by the way. I should have said that. He's my goat, bro. I searched up like what is like how to become a biomedical ethicist or whatever, and he was like one of like the first few results, so that's cool. That I got taught by that person. Wow. Anyways, um, what am I talking about? Oh yeah, let me go and see it if I miss anything. Okay, yeah, Judith J. Thomson, violin violinist case, pregnancy through rape. Uh, tiny house, allowed to defend yourself, burglary, window open doesn't equal you can steal, moral indecency, violinist for 1 hour. Okay. Don Marquis, why is killing wrong? Deprives person of whatever positive experience they could have. That's, yeah. Oh, I did forget to. Okay, so there's something he uses this term. I just decided to like add it there in case or whatever. He uses this term called prima facie. I think that's how you pronounce it. It's basically to say like at face value. You know what I mean? Like looking at generally speaking, like looking at this at face value, it's whatever, whatever. And so he basically says it's wrong to kill. It's wrong to kill us because it deprives us of future value. Fetuses have a valuable future, therefore it's prima facie wrong to whatever, whatever. But yeah. Oh, okay. Then we're going. Oh, okay. How do I? Okay. Then we're gonna go to advanced directives. This is Dresser and Dworkin, I think. Dworkin takes on the stance. So advanced directives it starts off with this like case analogy situation thing that has to do with a dementia patient named Margot. And so basically the idea is that Margot pre-dementia was like, if I ever am in this situation, I wouldn't want that for myself. I do not want that. I would not want to live like that. I wouldn't want to continue living. Um and then now Margot has dementia or whatever, but she's happy. Like it's not like they make it a point to say that she's happy. It's like, oh, now what do we do? Not Dresser, Dworkin is basically like taking on the stance that basically Margot should die. Like it's like he has this like I guess you could say consistency argument where it's like he a critical interest of hers, like something important to her has been this one thing consistently throughout her life. That is what matters. What matters is what's been there for your whole life rather than um the smaller part of your life. I explained that really badly, but that's basically what it is. Like it's like she didn't want that for her whole life. She wouldn't want that now. We should respect that decision. That's more of a like a more important thing to her. Um, and then what's it called? And then we have Dresser. Her thing is that she's like Dworkin is wrong. Okay, she's basically like if Margot is happy, why should we why should we care? You know what I mean? Like why should we interfere? And she basically makes it a point to say that Dworkin thinks and assumes that people care about consistency and coherency a lot more than they actually do. What actually matters to them is the what time is it? What actually matters to them what actually matters to them is their relationship and like suffering. Like it's like they're seeing their grandma, or for example, or their mom, like they're seeing Marco suffer or whatever, and they have a relationship to them, like they don't want to whatever, whatever. And then she also makes a point that it's like that's not Margot anymore. Like what past Margot would want or whatever doesn't matter because it's not Margot anymore. Because it's the thing where it's like, are you your body or your mind? Like, are your mind or whatever? Like, if your body changes but your mind doesn't, like are you still the same person? If your mind changes and your body doesn't, are you still the same person? So she makes it like a point to say like, oh, what if that was my mom calling me, it was tired. But anyways, what if what am I saying? Yeah, like maybe Margot just doesn't exist anymore. Okay. Yeah, Dworkin Dresser. Advanced Ray Dworkin let Margot die. What's best for her is determined by what's best for her whole life. Critical interest. Dresser, Dworkin is wrong. Margot doesn't care about her past wishes. Why should we? People care less about coherence. What matters more is relationships and suffering. Margot may no longer exist. Okay, now we're on to public health. Uh-oh, I don't remember the people for this one. I'm gonna do another thing where I just list up the names after. public health. Oh, I remember. Okay, I remember Sarah Conley. I don't know the first person. Public health has to do, so there's a libertarian point of view, which is like full freedom. Let me put this here. Full freedom, no, like, not no, but minimal government intervention. And so the first person, I don't remember her name. I'm not gonna lie. Oh wow, did you see how messy my room was? All the clothes on my floor. Anyways, it's actually not that much. It's been worse. Anyways, so she has the thing where her thing is that I don't remember her name. Oh no. What's his name? Oh yeah, is that the state basically isn't like when they do try to interfere or whatever, they often don't like interfere with public health. They often don't achieve their goals. And so an example of this would be like when it comes to like it, basically to say like when state intervenes and stuff like that, right? There could be a consequence of like for example over criminalization, and that starts moving like moving people's attention away from the wrong thing, to the wrong thing. I mean, an example of this would be I don't remember his name either. I feel so bad, but the person that really like started the BLM movement, he was the one that his like flow of air or whatever was restricted by his neck because like a cop was like pressing his neck down on the like, concrete or whatever. He was he was what's it called? He was selling cigarettes. And that's why like the cops were called. You know what I mean? And so it went from trying to promote like a policy of like don't sell this thing or whatever, but it like got like obviously that's not what people are talking about anymore. You know what I mean? And so another thing is I don't remember there's one I'm missing. I know there's one I'm missing, I think. But another thing is that they just don't like state doesn't have the like a lot of physicians don't have the authority to do things. Why should the state? You know what I mean? Like if physicians like the state doesn't know better than a physician does. You know what I mean? I don't remember the other thing. Ah, I don't remember. Okay, and then there's libertarian paternalism. Libertarian paternalism is basically like we're not gonna get rid of any of the options. Whoopsies. We're not gonna get rid of any of the options, but we will give you a little nudge towards the good ones. So, like an example of this would be like a cafeteria. You put all the healthy ones in front. That's what people get first, or whatever, and then they realize there's the unhealthy ones in the back, or whatever. And then we have the coercive paternalist. Her name is Sarah Conley or something like that. Conley. Um, her thing is that she thinks like people cannot be trusted to their own devices. She thinks like if people are trusted to their own devices and like whatever, they will do like unhealthy things. For example, like smoking, right? And so she just completely doesn't trust them. She thinks like ban all unhealthy shit, like that kind of thing. I feel like I'm missing something is the problem. I will say like in the thing, like it does go to say I don't have this in my notes, but in my actual like lecture notes that I took during lecture, um, she kind of like makes a point to say like it's not that it's a push for a certain lifestyle. You can still have autonomy. And so I think like a good example of this would be like there's laws, but that doesn't really affect like you can still do things. You know what I mean? Your autonomy isn't fully restricted. Okay. Um, public health, libertarian, max freedom, minimum government. Oh, Jessica Flannigan. Um, public health interventions often fail to achieve their goals. Yeah. Oh, unhealthy doesn't equal wrong. That's her second point. She's basically like just because you can be healthy and still have like a sweet treat. You know what I mean? Unhealthy doesn't equal wrong. State lacks authority. Libertarian paternalism, guide to good options. Sarah Conley, coercive paternalism. People can't be trusted to make good decisions. Ban unhealthy behaviors. I guess I did say. Okay, I'm gonna. Ooh, genetic screening. I know. I just saw the welfare versus. I know there's Jeff McMahan. I don't know who the other person is. Oh my god, I feel bad. I don't know her name. Um, Okay, so in terms of genetic screening, um, for those who don't know what genetic screening is, it's basically what's it called? It's how do I explain it? Okay, actually no, this would be too long to explain, but like long story short or whatever, when you have an embryo or whatever, you can when you can basically choose like the sex, you can choose like if whether it has a disability or not, or whether it has a certain disability or not, like that kind of thing. And so the first person, oh my god, don't remember. How do I not remember? Okay, whatever. Let's start with welfare and minimal difference model or something like that. Mere difference model. So what was the first one? It was mere difference, a welfare model. So the welfare model in terms of disability, the welfare model is what's it called? It's basically the welfare model is basically saying like a disability is described as any sort of psychological or physical thing. I don't really know the word thing that like that not like prevents opportunity to you, but like affects you. Affects you in the sense that like limits you. Oh my god. This is the one I last wrote down too. I should remember this one, but whatever. And the mere difference one is basically saying like people like that like some people don't even consider their disability as a disability. Like some people like also value their disability if they do consider it one or they don't consider it one. Like it's to say like it's not that it's just you just happen to be different rather than you're struggling. The welfare model looks at like your livelihood basically. It says that like I don't know. Oh, I remember part of the first one. So one of them, the first one, not the McMahan one, um, her, I think, one was basically about how children specifically have a right to a future. And like what that means is basically like having purposefully having a blind child limits their future. That is her point. I don't remember. The problem is I don't remember that much. But I do know the objection to that is it is a very easy objection. It's like just because you're blind doesn't limit your autonomy, doesn't limit your future or whatever. It just like it's like you can make an argument where if something makes you struggle a little bit, which is like when you if you're born with it, like are you truly struggling if you're just used to it, whatever, like you know what I mean? But if you struggle with it, like it's kind of it's not it doesn't mean you're limiting anything. It just takes a few more steps, right? But McMahon has the thing where it's like he oh my god, I don't remember what he first thinks. Oh, he makes a distinction where he's like I don't think people I don't think people should if there is a disabled person, they shouldn't be discriminated against, but that does not mean that has nothing to do with the question on whether it's wrong to do a genetic screening thing. And so he has a consistency argument kind of thing. He uses this like analogy scenario thing where it's like there's this drug that a woman can take that's like an aphrodisiac, and you can take it to increase heighten your sexual pleasure, but obviously like if you get pregnant and stuff like that, there's a the stuff happens with the egg where I think it like gets fertilized and broken and then fertilized it, something like that. I don't really remember the details. And basically, what happens is you will result in a child that is sorry, a woman will result in a child that is like has a very serious disability. And so, what's it called? Um, And so the hypothetical he gives is like a woman takes this and knows this, and she's like, you know what, like honestly, like having a child that's a little bit more dependent, like that's dependent on me, like that's fine or whatever. I want to have a child, that kind of thing. And it's like if you basically don't agree that that's okay, if you basically think that's not okay, then you it doesn't make sense to agree with genetic screening. You would think genetic screening is wrong as well. So if you think that's wrong, you're gonna think genetic screening is wrong. If you think that's right, then you think genetic screening is also right, basically. Or if that's okay, I mean. Okay. Welfare. To have a disability is to have a physical slash mental property that makes you worse off. Okay, that makes sense. Mere difference. Many people claim to value their disability, or their disability or deny it is one. Excuse me, by the way. Dina Davis, that's her name, Dina Davis. Right to an open future. Making child deaf limits its futures. Oh, I guess I did say everything. The objection is being deaf doesn't limit autonomy. That's the most popular objection. Jeff McMahan, consistency argument. It is wrong to discriminate and wrong to prevent serious disability. Oh, it's wrong to discriminate slash wrong to prevent serious disabilities equal different. I'm saying those are two different things. And then I wrote drug case, aphrodisiac and stuff happens where baby would have a very serious disability and she wants to have a child. Did she act wrong? And that's it. Okay, this is an oral exam, so wish me luck because it's in an hour. Bye.